The maternity team at Portsmouth Hospital's NHS Trust operates a successful and highly respected service, delivering about 6,000 babies every year. There are 4 midwife-led birthing centres which are run by midwives who specialise in promoting natural birth, and a consultant-led labour ward at the Queen Alexandra Hospital in Cosham. In the majority of cases, a pregnancy is completely normal without complication or concern. In these circumstances, many women prefer to give birth in one of our 4 maternity centres nearer to their home. But for some people, there is nowhere more perfect to welcome the newest addition to their family than in the privacy and comfort of their own home. On this tour, we hope to show you a brief overview of all the services and locations on offer to you during your pregnancy and childbirth, and an opportunity to meet some of the staff. Now let's take a look. We hope this video will help you when discussing your birth options with your midwife. To contact a midwife to inform her of your pregnancy, please call your local birth centre. At the Queen Alexandra Hospital, you will have all of your pregnancy scans in the maternity outpatients department, located on B level. After your initial meeting with your midwife at your booking in appointment, your scan appointments will be arranged for you. A typical pregnancy has 2 scans. Firstly, a nuchal scan done between 10 and 14 weeks. This will give you your estimated due date, and if you have chosen the Down syndrome screening, the fluid at the back of your baby's neck will be measured at this scan. Your second scan will be done at 20 weeks. This is your anomaly scan. First stop is B5 in the QA.
Welcome to the Mary Rose Ward B5 here at QA. We are a midwifery run unit, not attached to the labour ward, but midwifery led from the community. We are a small unit, very vibrant, very busy, very friendly, offering one-to-one care from a community midwife in Portsmouth. We offer the water birth. What I would advise that when you ring in when your labour has started is ring in and request at that point that you would like a pool birth. If the pool is free, then you're more than welcome to use it, but there are other pools within the area that we can use if that's what you really wanted. We offer the gas and air, which is the Entonox, and we offer pethidine, but we do not offer epidurals here on the Mary Rose. As midwives, we monitor your care in labour very closely anyway. If we at any point got concerned, we'd actually transfer you round to the labour ward to where you can have more intensive monitoring, where they can observe you or the baby more closely. At the moment, we have 3 labour rooms and we did over 700 births last year. So it is a very busy, lovely unit to work in and to have your baby in.
At B5 we have 3 single bed birthing rooms, one with a birth pool with an ensuite shower room. Here at Portsmouth Hospital's NHS Trust, we promote family-centred, individualised care, helping to keep mum, dad, baby and the extended family together. Well mum and babies go home to their families as soon as they're ready after giving birth, and support will be given to you by your local midwife or maternity support worker in the community. And a 24-hour telephone advice line is available to you if you have any concerns.
I'm Kate Finch. I'm the infant feeding advisor for Portsmouth Hospital's Trust maternity department. I am a midwife here, but I practice looking after mums breastfeeding, supporting breastfeeding, responsible for educating the mums and staff around the benefits of breastfeeding and how to breastfeed. I met Kerry yesterday when I was running a drop-in breastfeeding support group that we've just started at Queen Alexandra Hospital for mums to drop in before they go home. If they've got any problems, we'll always go back to the bed and help them with those problems, but we just give a general chat about positioning and how babies latch and what to look for to know that the baby's feeding well. And we've been doing that for a week and it's actually going really well, so we're quite pleased with that.
Hello, my name's Karen. I'm a maternity support worker on B5, otherwise known as the Mary Rose unit. My role is to support the midwife in carrying out various duties. In our daily role we would help possibly with working in the delivery suite sometimes, helping new mothers, especially things like baby baths, nappy changing, showing them how to handle baby. You'll recognise the support workers by the uniform that they're wearing, as I am. These support workers do similar roles in the outlying birth centres such as Great, Petersfield, Grange and the Portsmouth Maternity Centre down at St Mary's Hospital.
Adjacent to B5 is the consultant-led labour ward, B8.
Hello, welcome to our main labour ward B8 at Queen Alexandra Hospital. My name's Hayley Chambers, I'm one of the midwives here. This is one of our monitors that we use if you require monitoring in labour, which quite often the time you will be if you're on B8, because this is a ward where we do take ladies who might have more slightly higher increased risk during their pregnancy and possibly labour. This is our gas and air, Entonox. Again, it's got quite a long lead on it, so you can be, again, quite mobile and change positions as required throughout your labour. We do have other equipment on the wall, which is more emergency equipment. Okay. This is our bed, which is functional for different positions. So backrest will go up and down. And there are other functions on the bed that we use as a midwife to get you optimal positions for your labour if needed. You've probably seen one of these before. This is what we do blood pressures with. So you would have this done during your antenatal time. All of our rooms on B8 have an ensuite facility, so you have your own toilet and your sink and your own bath to be able to use during labour. We possibly may have resuscitaire in the delivery room when you deliver, so we do get a lot of ladies that deliver prematurely. On site we have the paediatricians who are just next door, the doctors are on labour ward at all times, and we also have a theatre at the end of labour ward, so we have anaesthetists ready, so any situation we all have help on hand straight away.
I'm Ken, I'm one of the doctors on labour ward. This is one of the delivery rooms. For most women who come here, they probably won't come into contact with us because Britain is actually very unique in that we have very well trained midwives who look after the majority of the deliveries. And it's a very small proportion where there are factors which makes it slightly abnormal, slightly higher risk. We do get involved, and essentially our job is to make sure there's a healthy mum and healthy baby at the end of delivery.
Theatres are located on the labour ward. There are also anaesthetists to help deliver extra levels of pain relief if required.
I'm Dr Taylor, I'm one of the anaesthetic consultants here at QA, and this is Dr Napier, who's one of the anaesthetic registrars, which is a senior trainee at QA. We have both consultants and trainees here 24 hours a day, 365 days a year in the maternity unit. We're currently in an operating theatre where some of the mothers do end up when they're delivering. However, quite a lot of our work involves preoperatively seeing patients, either those with particular problems or those who wish to discuss pain relief prior to going into labour. We also see a lot of mothers on the labour ward and helping them with pain control, particularly by use of epidural anaesthesia, which is a very simple injection of local anaesthetic into the back. We also see patients when they come here to the operating theatre, principally for caesarean sections, but also for any other intervention that's required. We ensure that their stay is as comfortable and safe as possible. We follow everybody up the following day that's had any sort of anaesthetic intervention, and we also get involved with the more complex cases on the labour ward, where we have input into the acute observation unit.
Hello, my name is Christina Woodford. I'm a recovery practitioner, and this is the recovery area, and this is where all the ladies come after they've been to theatre, and they stay here for about 20 minutes before going back to the ward, if all is well.